Peptic ulcers are erosions in the wall of the stomach, duodenum, or esophagus. They occur via an infection of the GI system by Helicobacter pylori bacteria. H. pylori or Helicobacter pylori is a gram-negative microaerophilic spiral-shaped bacteria which is associated with 70 to 90% of peptic ulcers. Ulcers may also be caused or worsened by NSAIDs. The main cause of peptic ulcer formation is chronic inflammation due to H. pylori colonizing the mucosa of the GI tract. The immune system is unable to clear the infection, which leads to bacteria causing chronic gastritis, which results in a defect in the regulation of gastrin production. And in most cases, gastrin is decreased, resulting in a too acidic environment. So this contributes to the erosion of the mucosa, which leads to the ulcer formation. NSAIDs also block COX-1, which blocks prostaglandin function, which stimulates the secretion of gastric acid. Prostaglandin is normally a protective factor. Stress as a factor is still under debate by experts. Some signs and symptoms of ulcers include abdominal pain near the stomach, which is the most common symptom, especially around mealtimes, specifically around 3 hours after a meal, bloating, abdominal fullness, nausea, vomiting, especially a large amount, loss of appetite, weight loss, vomiting blood, and melena, which is a dark stool which results from partially digested blood cells. Rarely, gastric or duodenal perforation occurs, which leads to acute peritonitis, which is very serious and requires surgery. Treatments for peptic ulcers caused by H. pylori include antacids, prostaglandin analogs, which are used to replace the prostaglandin formation blocked by use of NSAIDs, and combinations of 2 antibiotics along with 1 proton pump inhibitor. For resistant infections, 3 antibiotics may be used together with a proton pump inhibitor. Bleeding or perforated ulcers require immediate attention through surgery or endoscopy procedures.